Bismillahirrahmanirrahim. Now we are going to talk about the Norma Lateralis. Here are few important points which are important in the Norma Lateralis. Pterion, one part is pterion, which is formed by the four bones. What four bones? Frontal bone, parietal bone, temporal bone and sphenoid bone. FPST. You can remember this mnemonic for the remembrance or for memorizing the bones which are forming the pterion. That is in the weakest point when there is a lateral blow from the on the head side. So there is injury on this part or on this suture. There H-shaped suture. Middle meningeal artery is present, so there is most likely chances of getting it fractured. Okay. Now comes to the asterion part, which is present on the occipital bone. This point is very important for the surgeons. During the when the surgeon has to approach the posterior cranial fossa, and during the burr hole, making the burr hole in during the craniotomy procedures to avoid the chances of injury to the sinuses. So to avoid the severe damage or to avoid the massive blood loss or prevent the hematoma, this point has the importance to avoid the chances of getting damage to the sinuses. Okay, now comes to the zygomatic part. This is the zygomatic bone, and this is the zygoma, and here are the this is the temporal this is the maxillary process of the temporal bone, and this is the this is the temporal process of the zygomatic bone, and here lies the external acoustic meatus. There is another name is for this part, external auditory meatus. This is the mastoid process of mastoid part of the temporal bone, and this is the styloid part of the temporal bone, and between the styloid process and the mastoid process, here lies the stylomastoid foramen. It has certain importance as well. Okay. From the stylomastoid foramen, which content passes facial nerve and facial artery passes. Okay, and here is the petrotympanic fissure between this part. This is the condylar fossa on which the condylar part of the mandible articulates over here, and for the mandible I am going to make a separate video of it. That's it.